Okay, so we're going to do the tandem walking test. Primarily, you're going to see this in the clinic for concussion evals, but you can also do it if you're testing all the cranial nerves at once, for some reason like that, and this one's primarily for the vestibular nerve. So what I'm going to have you do, sir, is walk this line, which is 10 feet, heel to toe for me, and I'll be behind you just to make sure you don't fall over. A positive for this test is if they have any gross imbalance with it, and they're falling off and swaying a lot.
Record.
Okay, now we're going to test all the cranial nerves. So first we'll start with the olfactory. Can you smell anything? You smell anything funny, like a burning sensation? You smelling toast? No toast? Okay, and next we'll do the optic nerves. So I'm just going to have you follow my finger real quick here. I'm going to cover this side for you. Follow my finger left to right. Okay? Okay, good. Other eye. Okay, good. Next we'll do the occipital, which is the pupillary rotation. My bad. So basically, I'm gonna flick out here like this, and you're gonna tell me yes or no. So just look straight at me. I'm gonna flick out here, okay? And you see yes, you saw the flick, no, you can see flick. Yes. 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 Good. Yes. 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 Good job. Okay, for the next one, we're going to do the trochlear, which is upward eye rolling movements. So we already did that. Basically, that was you lifting your eyes up and I was moving the finger up and down, so you would peel on that one. Next is the trigeminal, which is chewing. So I'm just going to have you chew your, like I said, chewing. Great. Do you have any pain with that? Any problems, struggles? Nope. Perfect. Next, we're going to do the facial nerve, which is smiling. So smile for me. You frown for me. Okay, good job. Next, we'll do the vestibular, which we already did. Was a tandem walking line, so that was good. It was good balance. We'll do valgus, so that's swallowing. So if you can swallow for me. Do you have any trouble swallowing? Any pain? Any differences in that? Sweet, perfect. Next, we'll do the accessory. So you shrug your shoulders for me real quick. Good one, push down. Good. Okay, relax. And then we'll do the hypoglossal. So have you stick your tongue out for me. Left, right, up, down. Good job. And for the last one, do abducens, which is lateral eye movement. And we already did that. We moved your eye left and right while following my finger. Okay, good job. And for the last part, I'll just make sure you get pupillary good reaction. Okay, so close your eyes. Okay, open your eyes. Good. Okay, open your eyes. Okay, close them both. Open them. Okay, good job.
Yep.
Okay, the next test we're going to do is the fracture test, is the compression test for fracture of the ribs. So I'm going to have you do. I'm just going to squeeze here. And here I'm checking for any pain or guarding of the muscles, and this is testing for rib fractures, and you would primarily see it only for rib fractures in the clinic.
Go.
Okay, the next test we're going to do is the Adson's test. This is testing for thoracic outlet syndrome. Mainly we see any kind of nerve impingement, any other cranial nerves. We may have a problem with what I have to do is the patient sitting, I have adduct his shoulder 30 degrees, externally rotate and extend his elbow, and then I'm checking for his radial pulse. And I'm checking to see if it's diminished, not there, absent, and I'm also going to check that bilaterally, so you can relax that arm. I'm going to take this one, and I'm going to check, I'm seeing if the one in the injured arm or the injured side is diminished or if it's different by any ways.
Go.
Okay, next we're going to do the vertebral artery test. This is testing for an injury to the vertebral artery and maybe an indication for us not, a contraindication for us not to do any treatment on you. Okay, so what I have you do is put your feet at that end of the table and your head on this end of the table, and you're laying on your back. There you go. So what I have you do is you're gonna extend the cervical like this. Okay, open your eyes really quick, and then I'm gonna rotate you like this, and you're watching the pupillary for any confusion, dizziness, and then you're also asking the patient if they have any pain, dizziness, confusion, or any nausea or vomiting that they feel. Okay, thanks. Sweet.
Record.
Okay, next we're going to do the BEST test. This is also another test you can do for balance during a concussion eval or any cranial nerves you're allowed to do. So for the first part of the BEST test, I'm just going to be staying on both feet like this, staying straight, and I'm watching for any balance. You might want to close your eyes. Sweet. Looking for any balance, errors, and that's how you get scores. You can lose a point if they fall, shift, lose balance, touch the ground. Okay, next, part 2, staying one-legged on the flat ground with your eyes closed also. So as you touch the ground, that would be a minus score there. Okay, next part. Open your eyes. Now put your heel and toe together. Like that. I'm just going to have you close your eyes and try to hold your balance there. Okay? Now for the fourth part, we're going to have you do the 3 tests again, but this time on a pillow, because I want to have a foam object to do it on. So have you stand on both feet together. Good. Okay, close your eyes. Alright, looks good balance. Okay, I'm going to have you stand on one leg. Close your eyes. That's a minus score. That's a minus score. That's a minus score. Okay, just relax. Okay, and then have put your heel and toe together again. You have to angle yourself. Okay, and then hold your balance. Let's go.
Go.
Okay, we're going to do Babinski scan. This is testing for upper motor neuron lesion. So what I'm going to have you do is I'm going to have you sit back at the end of the table for me real quick. Your foot hanging off. Sweet. Okay, and I have you want to take off your left sock here. Okay, and what I'm going to do is I'm going to trace from the heel up to the big toe in the shape of an R, and what I'm looking for a positive sign is if his big toe extends and his toes sprawl out almost. If they flex towards me, that's negative, but if they extend and kind of sprawl, that's positive for an upper motor neuron lesion. We may see this near concussion, any cranial nerve injury, or any like lower back nerve impingement. He's negative.
Record.
Okay, it's another test that we can do for the thoracic outlet syndrome. It's called the military brace test. So what I'm going to do is stand up for me real quick. Okay, you're going to do the same thing. You're going to take their arm, you're going to abduct their shoulder 30 degrees, have it externally rotate, and I'm also testing for the radial pulse to disappear or dissipate. I'm also going to check that bilaterally. So you can relax your right arm. Check your left arm. And he would be negative. Positive would be that radial pulse dissipating or being altered or diminishing anyway.
Go.
Okay, so the next test we're going to do the Sperling test. Is how you test cranial nerve injuries. So what I'm going to do, you go behind him. This. I'm going to take this, I'm going to laterally flex the cervical. I'm going to apply pressure. Looking for any pain or guarding. Now they may have guarding just because you're pushing pressure on it. There's nothing for pain or any numbness or tingling that the athlete may feel. And this, we may see this due to a concussion, cranial nerve injury that an athlete may occur, and the positive just says they have cranial nerve impingement.